Welcome to this webinar on sensory nerve conduction studies, reducing noise, interference, and artifacts. Sensory nerve conduction studies are done in two ways, antidromic or orthodromic. In the antidromic method, illustrated over here with the median nerve, we are stimulating at the wrist. Here is the cathode and anode, and we are recording over the digit. We have the active and reference electrode. The action potential is propagating from the wrist to the fingers, which is opposite of the natural flow of action potential, and hence it's called the antidromic method. In the orthodromic method, illustrated on the right, we are going to stimulate distally over the index finger, and we will record the sensory nerve action potential proximally over the wrist. Either of these approaches can be used to record the sensory nerve action potential. The sensory nerve conduction studies are extremely useful in electrodiagnosis. They are very sensitive to detect pathology, for example, carpal tunnel syndrome. So here is an example of a bilateral median sensory nerve conduction study. We can see the response on the affected, the right side on top. It has increased latency, lower amplitude, and it also has a broader waveform. In many mononeuropathies, for example, carpal tunnel syndrome or ulnar neuropathy, it is not uncommon that sensory nerve conduction studies are abnormal before the motor nerve conduction studies. Sensory nerve conduction studies are also useful to localize the lesion. So in this schematic, we have the spinal cord on the left. Then we have the nerve roots that come out of the spinal cord through the vertebral column. And then we have the formation of the nerves. If we have a lesion which is at the level of the root, as indicated by this hashed rectangle, this is called a preganglionic lesion. Notice that the sensory ganglion is to the right of the lesion. So under this condition, the motor nerve conduction studies are affected, but the sensory nerve conduction study is normal. In contrast, if the lesion is distal to the dorsal root ganglion, this is called the postganglionic lesion, then the motor and sensory are abnormal. So the sensory nerve conduction study is very useful to localize the site of the lesion. Abnormal or pinched nerve near the root or in the plexus area, mononeuropathies, these are the most common referrals for an electrodiagnostic study. So you can readily see that sensory nerve conduction studies are extremely important in many conditions and in most patients referred to the electrodiagnostic study. The problem is that the conduction studies for sensory nerve are very challenging. They are very useful, but often considered difficult. And this arises due to the low amplitude of the response. It is often less than 25 microvolts even in normal nerves. Now compare this with motor nerve conduction study, where the response can easily be several thousand microvolts. So the amplitudes of the responses between motor and sensory differ by a factor of almost 100 to 500. Because of small amplitude, sensory nerve conduction studies are considered challenging or difficult. Now this response is contaminated by high amplitude noise and interference. We get electromagnetic radiation from all the devices in our examination room, but also from devices that are outside, for example, radio or TV broadcast stations and so forth. That electromagnetic radiation can have very high voltage. So the problem we have is a very low signal to noise ratio. The signal is small, the noise is large. We can reduce some of the noise by using techniques like averaging, but that requires multiple stimulations. And stimulation is quite uncomfortable. So in this webinar, we are going to look at how we can reduce noise, interference, and artifacts. For simplicity, I'm going to divide them into 4 categories. The noise refers to the ambient noise. This is generated by other electronic devices, and it is recorded by the electrodes and cables. Then we have the so-called motor artifact. This is the volume conducted activity from muscles that contaminates the sensory nerve action potential. This occurs because of co-stimulation of motor nerve fibers. Then we can have EMG interference. This is the volitional EMG activity produced by the patient himself or the patient herself. And this occurs when the recording electrodes are sitting on top of muscles. And when the patient moves, the muscle contracts and we record the EMG interference. And finally, we have the stimulus artifact. This occurs due to the spread of stimulation current from the stimulation site to recording site. And we cannot avoid this. We need to stimulate the nerve, and therefore the stimulus artifact will be present. So now let's consider different strategies by which we can reduce all of these contaminants to the sensory nerve action potential. Let's start with the ambient noise. The best strategy is to reduce the ambient noise as far as possible. Here are some simple tricks. Do not use fluorescent lights or the so-called tube lights because they give out a lot of electromagnetic radiation. Instead, use use incandescent lights. Do not use dimmer switches for lights. They also give out a lot of electromagnetic radiation. This kind of noise or interference is usually seen as thin spikes in the baseline that are repeating at the power line frequency. So you will see them at 50 Hertz or 60 Hertz. Do not use extension power cord. The power cord is essentially an antenna, and when the electricity passes through it, it gives out electromagnetic radiation. So smaller the power cord, less will be the electromagnetic radiation. So avoid extension power cords. There may be other devices that are plugged into your wall outlet. It is customary to turn off that equipment. But as I just indicated, the power cord is still connected to the main power outlet and it's behaving like an antenna. So not only we want to turn off the electronic equipment, but then we also want to unplug the power cord from the wall outlet. Many times we use electrical beds to properly adjust the patient. Do use them, but if it is causing interference, unplug them when you start the examination. And make sure that your system is grounded. And this refers to the wall outlet. It has got 3 receptacles. The one at the bottom in some places, which is called the ground, that point is connected to a metal pole buried outside the building. It is useful for safety, but it is also useful to make sure that we have got proper high quality signals. The grounding can be checked by a certified electrician. I want to understand you to understand properly that there are 2 grounds that we talk about. One is the ground electrode, which is placed on the patient. The other is the ground in the wall outlet. Perhaps a better terminology for the wall outlet should be the earth. I should say the system should be properly earth. Anyway, these are some of the strategies to reduce the ambient noise. Now let's start with applying the electrodes. I'm initially going to show you via videos a bad technique of recording electrodes. I have applied the ground electrode. Notice that I did not use any gel. Well, there are several things that one should do before applying electrodes. One should clean the skin surface. This can be done by using water or alcohol swabs. Sometimes we can use abrasive paper or gel. And now we are looking at signal baseline when we do not have good technique. I'm changing the gain. Notice our baseline is not flat. I'm changing the time base. We are at 5 milliseconds per division, and that was 60 Hertz interference. We will stimulate the nerve, and we have a response that is difficult to recognize. It is not reproducible. So always look at the signal baseline. If the baseline is not good, don't even bother to perform the sensory nerve conduction study. Remove all the electrodes and start by cleaning the skin surface. Again, as I stated, this can be done by using alcohol swabs, water, and so forth. Sometimes you may want to use abrasive paper or gel. Use of gel, abrasive gel, is standard in evoked potentials. Sometimes I like to use it when the skin looks very dry, but be gentle. You need minimal amount of scrubbing. Now, when you apply the electrodes, put some electrolytic gel, and then secure the electrodes in place. We don't want them to move. We want them to have good contacts. We need to apply gel on all electrodes, active, reference, and the ground. So for ring electrodes, I often take a little bit of gel on my fingertip, put it on the ring, and then I rotate the rings so that they spread along the finger, as I'm doing right now. You don't need a lot of gel. You need very little gel. Let's look at the baseline. You can see it in the bottom right corner, and it looks flat, indicating minimum noise and interference. So this is the kind of signal baseline we should have before we start performing our sensory nerve action potential recording. Some laboratories also check the impedance. In sensory nerve conduction, I don't think it's terribly necessary. A flat baseline is a good indication. Let us stimulate the nerve again with proper preparation with the electrodes and gel and everything. And notice we have a very high quality response. So to summarize, apply the electrodes after cleaning the skin surface, use electrolytic gel, secure the electrodes, check the baseline, and when it looks flat, I think we are ready to start with our conduction study. Now, as much as we want to reduce the noise, some noise will always be there. We can attenuate it by using the so-called differential amplifier. This amplifier has 3 inputs, the black, red, and the green, active, reference, or ground, or I like to call it E1, E2, and ground. The amplifier measures the voltage difference between the signals at the E1 and E2 inputs and amplifies the difference. So in this case, in the top situation, we can see the noise is very similar, the difference is very low, and therefore at the output we have very low noise. If this noise is imbalanced, as shown in the bottom, we have more noise on E1, less noise on E2, they don't cancel, and therefore we get very high amplitude noise at the amplifier. So the strategy to reduce noise is to make it equal at both E1 and E2 inputs. Let us see how we can do this. Again, I am showing an example of a radial sensory nerve conduction study. Just as the power lines behave as antennas, our electrode leads also behave as antennas. So we want to make the leads as short as possible. And having insulated leads also helps. Now in this example, I'm deliberately using long leads that are spread all over my examination table. As I indicated, we want to have the same noise at E1 and E2 electrodes, and this can be done by interweaving the leads or braiding the leads. We do have electrodes available with braided leads, the so-called bar electrode or disc electrodes. Now in this case, let's look at our monitor trace. We have very high amplitude noise and interference. It would be impossible to record the sensory nerve action potential using just a few stimuli. So there is a simple trick that we can do. We can confine the leads to a small area. So if we keep all the leads together, and in a very small space, they will probably record the same noise, and that will be canceled by the amplifier. So I have packed up all the leads. I'm going to put them under the patient's hand, and now look at the baseline. It is quite nice. We should be able to record the sensory nerve action potential. So once again, remember simple strategies. Use short leads. If possible, use insulated leads. Use braided leads. If they are not braided, if they are separate leads, as you saw in this example, put them together in a bunch, confine them to a very small area, and it should get rid of a lot of noise. Let us now move on to the motor artifacts. The motor artifact is typically seen in the ulnar nerve conduction study. I am stimulating the ulnar nerve at the wrist, and we are recording from the small finger. That's a very nice recording. We don't have any artifact. Now see in the video what I'm doing. We will have the patient touch the fingers. We will stimulate again. And this time we have got motor artifacts. When the fingers are touching, it provides a path for the motor potential to reach the recording electrode. When the fingers are separated, that path is removed and we get far less motor artifact. We can prevent the fingers from touching by using a gauze to separate the fingers. Another simple trick is to take the roll of sticky tape and place them on the neighboring finger. Now the fingers don't touch and you will have less motor artifact. Here is another illustration, once again with ulnar nerve study. We are recording over the small finger and we will stimulate at the wrist. Notice the position of my E1 electrode. It is very much at the base of the small finger. When we stimulate, we get a lot of motor artifact. The fingers are not touching. You can see the muscle twitch or the finger movement indicating activation of the muscle. That's the abductor digiti minimi muscle, which is activated during nerve stimulation. And our E1 electrode is right at the tendon of that muscle. So what we are going to do is move the electrodes farther away from the muscle. So if we move the recording electrodes away from the source of artifact, it should be reduced in amplitude. When you move the electrodes, make sure you remove the excessive gel that would spread when you are moving electrodes to a new position. Otherwise, the gel will provide a current path over the skin surface to the muscle. You have now a new position of the recording electrodes. Let's use the same intensity and stimulate the ulnar nerve. You can still see the muscle movement, but we don't have the motor artifact. This problem typically occurs in antidromic conduction studies in hand. We can also get the EMG artifact. That occurs when the recording electrode is over the muscle. So in this case, I'm going to stimulate the long finger and record over the wrist. This is an orthodromic technique. I'm getting a lot of noise over here. It's a power line frequency interference. This artifact is not time locked to stimulation. So if we were to add successive responses, the noise will be positive on some traces, negative on the other, and by summating it, it will cancel. The sensory nerve action potential is time locked to the stimulus, and therefore it doesn't cancel. So here in this example, we can see the sensory nerve action potential and the artifact going down. We will stimulate again, and let's see what happens this time. We have the same sensory nerve action potential, same location, same shape, but the artifact is in the opposite polarity. So by stimulating many times, adding the responses and dividing the sum by the number of stimuli, we get the averaged response. So I have turned on the average here. And notice my baseline is much nicer. So averaging is a simple technique that can help us get rid of any electrical activity or voluntary activity that is not time-locked to stimulation. This technique is used quite frequently in sensory nerve conduction studies. Now keep in mind that averaging is not a substitute for poor technique. We should always do every effort to reduce the ambient noise and interference, because a single bad trace can significantly affect the waveform of the averaged response. In this case, we are doing an antidromic radial sensory nerve conduction study. We have a nice flat baseline. Let's stimulate the nerve by increasing the intensity. Beautiful triphasic response. Now, one may argue that we don't need to average this response, but for the sake of illustration, we will do it. Let's stimulate the nerve a few more times. I am averaging the traces. Now the patient is moving, and notice the quality of the response has degraded significantly. You can see the thumb being pushed into the palm. When the patient relaxes the thumb, the baseline becomes quiet. So that was a nice illustration of EMG interference. In order to attenuate this interference from a single trace, we will have to stimulate the nerve many times. I have now stimulated 7 or 8 times, but the baseline is still distorted. That emphasizes the problem with averaging. A single bad trace can significantly distort the waveform, and most often you have to restart averaging. That means it's going to take more time, it's going to be inconvenient, uncomfortable to the patient. Fortunately, modern systems allow us to edit the average or perform offline analysis. The yellow trace is the average trace, and you can see the buttons at the top which represent individual traces that went into the average. So when I place the mouse on it, it shows me the individual response, and then we can make a decision whether we want to keep it into the average or we don't want to keep it in average. So I'm going to click on these buttons to remove the traces that I don't like. Here is the response with a lot of EMG activity. I'm going to remove it, and notice the significant improvement by removing only one response. So this is a very powerful method of getting rid of bad traces in the average. So averaging will help you, but having the ability to edit the contents of the average can help you even more. This is particularly useful in patients who move a lot or pediatric studies. Let's now look at the stimulus artifact. The stimulus artifact occurs due to spread of stimulus current from the stimulation site to the recording site. The artifact will be less if our stimulus intensity is less, and we can reduce the stimulus intensity by improving the contact between the stimulator and the skin surface. Just as we clean the skin surface for recording electrodes, we should do the same thing for stimulation site. Also use electrolytic gel to improve the contact. Sometimes the patients will sweat, and the sweat along the skin surface provides a low impedance path between the stimulator and recording electrodes. So if you see sweaty palms, you may want to dry the skin surface to reduce this low impedance path. The stimulus artifact is reduced in many ways. One of the common strategy is to place the ground electrode between the recording sites and the stimulation sites. In this case, I'm recording from the radial sensory nerve. I'm going to place the stimulator in the forearm. Notice that my ground electrode is not between stimulation and recording sites. Let's stimulate the nerve. And in this case, we actually have what appears to be a response, but that was actually an artifact. Okay, so let's try to change the position of our stimulator and see how it affects our stimulus artifact. I'm going to remove the ground electrode, place it between the stimulation and recording sites, and let's repeat the stimulation. And this time we can see the response quite easily. The artifact is much less. The cable from stimulator also behaves as an antenna, and it will give out electromagnetic radiation or stimulus artifact every time we stimulate. And what we like to do is keep the recording and stimulating cables away from each other, as you see in the current setup. This is going to be an orthodromic conduction study stimulating the index finger. We have a beautiful sensory nerve action potential. The stimulus artifact can be seen at the beginning, and there is nice baseline. Now I'm going to move the stimulator, and we will let the cables lie on top of each other. The recording electrode is now going to pick up the stimulus artifact, and we cannot see the response. Let's change the position of the stimulator again. Separate the cables, keep them away from each other, and we have a good quality response. So if you're getting stimulus artifact, have a quick look at your stimulator and recording leads. If they are lying on top of each other, separate them. Let's look at some theoretical basis for the stimulus artifact. The stimulator has two poles, the anode and cathode, or the black and red. These are current sources which set up electrical field, and it is shown by the so-called isopotential lines, these oval or circular lines. And the squares are our recording electrodes. So this is my reference electrode, you can see at the top. This is the active electrode, and they are sitting on isopotential lines of different voltage. Because they record different voltage, this will not be cancelled by the differential amplifier. It will see the difference between these two. And this is how we get the stimulus artifact. So one strategy is to rotate our anode. So the recording positions are exactly the same between the right and the left. Our cathode position in gray is the same, but we have changed the position of the anode. I have rotated it down. And what it does is now it is rotating the entire field. And as a result, my active and reference electrodes are on the same isopotential line. And when this happens, the difference between the potential or the artifact recorded by active and reference electrodes will be very small, and we will not get a significant stimulus artifact. So let's look at this illustration. We are going to do a medial antebrachial cutaneous sensory nerve conduction study. The bar electrode is the recording electrode. The ground electrode is proximal, and we are stimulating above the elbow. The pin under the lit LED is the cathode. We can see the stimulus artifact. We can see the sensory nerve action potential. It's not a bad recording, but I think we could do it better. So we are going to keep the cathode in the same place, and we are going to change the position of the anode. That's called rotating. Let's see what kind of a response we get as we start rotating anode. Rotate it more. Notice the artifact is becoming less, and here we have a beautiful response. The artifact didn't interfere with the sensory nerve action potential at all. So the technique is cathode remains fixed on stimulation side, and anode is moved to different locations. As I go back to my original position of the anode, we have the artifact. Rotate the anode, the artifact becomes less. Another technique that we can use for reducing stimulus artifact is by manipulating the polarity of the stimulator. So consider on the right side, we have a monophasic stimulation. Here the electrical pulse is going up, indicated in blue color. This is producing an artifact which is going up. If I were to reverse the polarity, then the artifact will go in opposite direction because the electrical field produced by the stimulator is now reversed. So the two polarities of stimulation produce artifacts that are going in opposite directions. And this is the property that we are going to exploit in the so-called bipolar stimulation or biphasic stimulation. This is going to be a saphenous nerve conduction study. We have recording electrodes over the ankle. We are going to stimulate in the medial leg. We will start with a monophasic stimulation, and you can see the stimulus artifact, and perhaps there is a response sitting in it. For the purpose of illustration, now let's try to reverse the polarity. And I'm going to do this by actually reversing the anode and cathode. Let's stimulate again. And this time we will see the artifact going down. So those are the two states of this stimulus artifact, one going up, one going down. Now in the biphasic stimulation, we are going to use two stimulation pulses. The first one is with the standard polarity, and then the second one is of the opposite polarity, which comes immediately after the first pulse. So this is my standard placement. The cathode is distal, closer to the recording site. The first pulse is going to stimulate the nerve, give us a response, and the second pulse is essentially going to counteract the stimulus artifact from the first pulse. We have a beautiful saphenous nerve action potential. So this is something that we can use in our EMG equipment to reduce stimulus artifact. Another technique we can use is something called signal enhancer. I'm going to demonstrate it by using sensory conduction studies in the lateral antebrachial cutaneous nerve. Let's stimulate. We have a nice sensory nerve action potential. We can see a little bit of artifact. Notice that the artifact changes very slowly compared to the sensory nerve action potential. The artifact is almost like a U shape. We can study the nature of this artifact. We can study it mathematically. We can identify the artifact using the mathematical algorithms, and then we can subtract it. That should give us the response with less artifacts. So here is the original response, and here is after enhancement. Very nice baseline quality. Again, at the top, we have the original response, in the middle, the enhanced response, and at the bottom, you can see the U-shaped artifact. That's the stimulus artifact that was removed by the software. Notice that it did a very nice job of removing only the artifact without affecting the sensory nerve potential. So this is a very nice technique of reducing the patient discomfort and getting good quality responses. So to summarize, we have 4 different types of noises and artifacts. The ambient noise, the best strategy is to reduce it as much as possible. We can further reduce the noise appearing at the amplifier output by reducing electrode impedance. We can equalize the noise by efficient cable management, making sure that our system has proper earth connection. We should unplug unused equipment to reduce the noise and interference, use incandescent lights, and avoid fluorescent lights and dimmer switches. The motor artifacts are typically seen in the antidromic conduction studies of the hand. Place the electrodes away from the muscle if possible. Don't place them at the base of the finger. And prevent electrodes from touching each other. Prevent electrodes from touching the neighboring fingers. The stimulus artifact is best reduced by using as little intensity as possible. So clean the stimulation site, use electrolytic gel, dry the skin surface between the stimulating and recording sites. Keep the stimulation and recording cables away. Place the ground electrode between stimulation and recording site. Other techniques that can be used are the biphasic stimulation, which I find works extremely well in the sural, the superficial peroneal nerves, the plantar or the saphenous. We can rotate the anode to change the electrical field generated by the stimulator. Make sure the cathode does not change its position. Cathode should always be on top of the nerve. We can also use digital enhancement, the signal enhancer, which estimates the stimulus artifact and subtracts it from the response. If you are getting EMG artifacts, you can see them on your monitor trace. Ask the patient to relax. If you are getting power line frequency interference, you can use signal averager to reduce it. And it's a good practice to edit average responses if you are still getting noisy signals. Typically, this will occur if the patient moves. There are movement artifacts. Have a look at the traces that went into the average. Removing a single trace sometimes can significantly improve the signal quality. This looks like a very long list of things to do. But once you start using these techniques, it will become second nature. You always will automatically clean the skin surface. You will apply the gel, secure the electrode. You will always use a good technique for stimulation and so forth. So it becomes second nature. And then you will find that the sensory nerve conduction studies technically become less demanding, and you will be more confident, more happy with the responses that you get for your electrodiagnostic assessment. You can also visit the Natus Neurology Academy, and we have a clinical note which also covers this material in a printed format, reducing noise and artifacts in sensory nerve conductions. You can download it or print it for your convenience.